In medicine, most people imagine cancer as a lump, something you can see, something you can feel, something you can remove. But leukemia is different. Leukemia is cancer of the blood and the bone marrow, the system responsible for producing every red blood cell, white blood cell, and platelet that keeps the body alive. Instead of forming a solid tumor, leukemia spreads through the bloodstream. Quietly, silently, it alters the very cells meant to protect you. And that difference is what makes leukemia especially dangerous. What exactly is leukemia? Leukemia begins in the bone marrow, the soft tissue inside bones, where blood cells are made. In a healthy body, the bone marrow produces red blood cells to carry oxygen, white blood cells to fight infection, and platelets to stop bleeding. In leukemia, this process goes wrong. The bone marrow begins producing abnormal white blood cells. These cells multiply rapidly, but they do not work properly. They crowd out healthy cells. As a result, oxygen delivery drops, immunity weakens, bleeding risk rises, and all of this can happen quietly, long before symptoms become obvious. One of the most dangerous aspects of leukemia is how hard it is to detect early. Early leukemia often feels like nothing serious, just fatigue, frequent infections, easy bruising, bleeding gums or nosebleeds, a fever that doesn't explain itself, night sweats, and explain weight loss. These symptoms are often mistaken for stress, malaria, viral infections, or anemia, especially in low-resource settings. By the time leukemia is suspected, the disease may already be advanced. From a medical standpoint, leukemia is not one disease. There are several types. Doctors classify leukemia based on how fast it progresses and which blood cells are affected. There are acute forms. These progress rapidly and require urgent treatment. There are chronic forms. These develop slowly and may remain hidden for years. Leukemia is also classified by cell type: lymphoblastic leukemia, myeloid leukemia. Each type behaves differently. Each responds differently to treatment, and each carries a different prognosis. What causes leukemia? In most cases, there is no single cause. However, research has identified important risk factors: genetic mutations in blood-forming cells, high levels of radiation exposure, certain chemicals, such as benzene, previous chemotherapy, or radiation therapy, some inherited genetic conditions. It is important to know this. Leukemia is not contagious, and many patients develop it without any clear warning. How do doctors diagnose leukemia? Leukemia cannot be diagnosed by symptoms alone. Diagnosis requires medical testing. Blood tests, such as a complete blood count, peripheral blood smear, bone marrow biopsy, genetic and molecular testing. Modern diagnostics allow doctors to identify not just leukemia, but the exact type, and that information determines treatment. Decades ago, leukemia outcomes were often poor. Today, medicine has changed that story. Treatment may include chemotherapy, targeted therapy that attacks specific cancer pathways, immunotherapy that trains the immune system to fight cancer, and bone marrow or stem cell transplant. Some types of leukemia now have survival rates that were unimaginable a generation ago, but outcomes still depend heavily on when the disease is found. Early detection saves lives. Leukemia does not announce itself. It does not form a lump. It does not always cause pain, and it does not wait. Awareness matters. Recognizing early warning signs, seeking proper testing, and supporting early diagnosis can change outcomes. Understanding leukemia can save lives. If this video helped you understand leukemia better, follow this channel for evidence-based health education. Like the video, leave a comment, and share it with someone you care about, because the information you share today could save a life tomorrow.